Hi, this is Bernie Trend and welcome to our video on understanding cardiac tumors. In this presentation, we'll delve into the different types of cardiac tumors, their characteristics, and how they are diagnosed using echocardiography.
Let's start by defining what a cardiac tumor is. A tumor, or neoplasm, is an abnormal growth in which cell multiplication is uncontrolled and progressive. Cardiac tumors can be classified as benign or malignant and include benign primary cardiac tumors, malignant primary cardiac tumors, metastatic, secondary, cardiac tumors, and extracardiac tumors. Approximately 75% of primary cardiac tumors are benign. The most common benign tumor in adults are called myxomas, which are often found in the left atrium. These tumors are usually identified by their globular appearance and mobility. Myxomas may prolapse through the mitral valve, causing functional mitral stenosis. Pro tip: look for characteristic echocardiographic features, such as finely speckled appearance and stalk attachment to the interatrial septum. Also assess the degree of obstruction by color and spectral Doppler. Another benign tumor type is papillary fibroblastomas, commonly located on the aortic or mitral valves. These tumors have distinctive sea anemone-like fronds and are typically attached to the valve via a stalk. Papillary fibroblastomas appear as small homogeneous masses with highly mobile and independent motion. Pro tip: differentiate between fibroblastomas and vegetations by considering clinical history. Lipomas are benign tumors of the fat cells of adipose tissue. On echocardiography, lipomas appear as echobright, homogeneous masses found within any cardiac chamber, or the myocardium. A condition closely related to lipoma is lipomatous hypertrophy of the interatrial septum, LHIAS. Unlike lipomas, LHIAS is non-neoplastic and results from the accumulation of excess adipose tissue within the interatrial septum. LHIAS appears as thickening of the superior and inferior ends of the interatrial septum, with sparing of the fossa ovalis membrane. This characteristic leads to a distinctive dumbbell or hourglass appearance on echocardiography. Moving on to rhabdomyomas, these benign tumors originate from striated muscle and are primarily found in children. Often associated with tuberous sclerosis, rhabdomyomas present as well circumscribed, homogeneous masses with acoustic properties similar to myocardium. Careful examination of the outflow and inflow tracts is crucial, as rhabdomyomas may cause obstruction in these regions due to their location and size. Fibromas, which are benign connective tissue tumors and the second most common cardiac tumors in children. These tumors typically appear as discrete, well-demarcated echogenic masses within the ventricular wall, interventricular septum, or ventricular apex. When located within the interventricular septum, fibromas may mimic conditions like hypertrophic cardiomyopathy or ventricular septal hypertrophy, posing diagnostic challenges. While primary malignant tumors are rare, angiosarcomas are the most common type. These malignant vascular tumors are infiltrative into adjacent tissues and appear soft and hemorrhagic on gross examination. Angiosarcomas are most commonly seen within the right heart, especially the RA, or within the pericardium. Pro tip: on echo, these tumors have an irregular shape and might have evidence of pericardial involvement. Metastatic tumors, which are more common than primary tumors, often originate from melanomas, lung, breast, or renal cell carcinomas. They can cause various complications, including obstruction to cardiac chambers and valvular dysfunction. Pro tip: contrast agents can help differentiate between benign and malignant tumors. Moving on to intracardiac thrombus, which forms due to endothelial injury, hemodynamic changes, or blood hypercoagulability. Thrombi can occur in different locations, such as the left ventricle, or left atrium, or the right heart, leading to various complications. Pro tip: on echocardiography, thrombi appears as an echogenic, homogeneous mass, which may be fixed and laminated, or pedunculated and mobile. Lastly, it's important to differentiate normal anatomic structures from tumors or thrombi. Structures like the crista terminalis, Eustachian ridge, Eustachian valve, Chiari network, pectinate muscles or moderator band may mimic masses, but have distinct characteristics. Pro tip: Understand the echocardiographic appearance and location of these structures to avoid misdiagnosis. Extracardiac masses may also simulate intracardiac masses. These include pectus excavatum, the spine, the stomach, a hiatus hernia, and pericardial and bronchogenic cysts. Foreign bodies such as indwelling catheters, central lines, pacing wires, sutures and percutaneous closure devices can also be mistaken for intracardiac tumors and/or thrombus.
Well, we've covered a comprehensive overview of cardiac tumors and thrombi. Remember to apply these insights in your clinical practice. If you found this video helpful, don't forget to like, share, leave your comments and subscribe for more educational content. Thank you for watching.